It is my great pleasure to introduce to you with my team of doctors, students, nurses and staff the 2023 Awareness Month for Atopic Dermatitis. Especially I would like to acknowledge the lead work of Dr. Sarah Al-Khawaja and her team to prepare this exciting event. In the next 4 weeks, we will have 3 booths at different locations at Hamad Hospital, which will be in the Dermatology Department, the Rumeila Hospital, and Women's Hospital at Hamad Medical Corporation. Here, we would like to welcome you and provide you with information, education, and topical samples about the deleterious disease for many patients and families. We also will give you information to make management, appointments, and counseling easier for the patient in the future, and to better control this chronic disease. So what is atopic dermatitis? Briefly, it is a very common, non-infectious, but chronic, reoccurring, inflammatory skin disease that affects 15 to 20% of children, 10% of teenagers, and 5% of adults. It can lead to burdensome life for patients and families that affects work, university, school performance, sleep, and concentration, thereby leading to depressive mood, yes, even depression, anxiety, embarrassment, staining of clothes, stopping to socialize with family and friends. Patients with atopic dermatitis suffer from severe itching, often all day and night, and oozing eczema that can lead later to dry lesions that are still itchy and flaky. It can be also associated with burning, painful lesions, and infections. The etiology of atopic dermatitis is poorly understood. We now know that genetic predisposition plays a role because patients with family members of atopic dermatitis have a higher risk to develop atopic dermatitis and other diseases such as asthma, for example. In addition, environmental trigger factors such as humidity, sweat, synthetic clothes, stress, irritants, allergens, for example, house dust mites, food, or animal dandruff can initiate a flare-up in the patient, which aggravates into a vicious cycle of inflammation, itching, scratching, and skin barrier dysfunction. The atopic dermatitis disease is characterized by an abnormal reaction to those trigger factors, resulting in inflammation and skin barrier dysfunction, which leads to the associated symptoms like itching and or also pain. Through basic research, we have learned that certain proteins of the immune system called interleukins are critical to initiate, to aggravate or perpetuate the inflammation, the skin barrier disruption, as well as itching and scratching in the atopic dermatitis patient. Today, we have new medication at hand that are capable to block the negative effect of these interleukins, mainly interleukin 4, 13, and 31, very effectively and with less side effects than with systemic cortisone, for example, which is no longer necessary except for few exceptions and for a short period of time. These injectables have a very low side effect profile, and patients with atopic dermatitis all around the world profit now from these new treatments which we also have available. In addition, the usage of new topicals, the availability of phototherapy at Hamad Dermatology Department, and new tablets are important new developments which now help to better control the disease so that patients and families can live again a normal life, and this also long term. Finally, with our dermatology team in Rumeila Hospital, we are very happy to help you and your families with educating about treatment, how to reduce flare-ups, the pros and cons of any therapy, and about the safety for each medication. We are also happy to support you how to address stress factors which can help to control the disease even better. So thank you very much for your attention, and I wish you and your family a blessed month. Finally, my gratitude goes to all the staff members from HMC Dermatology, especially Dr. Sarah Al-Kawaja, Sister Hala, and the team, the leadership of HMC, and the ministry for their continuous support. Also want to thank the students from Qatar University and Weill Cornell University who participate in this first Awareness Month activity in Qatar. Shukran.